better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise,
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.
Welcome to the podcast.
Welcome to the podcast.
Okay, everybody's been asking me, who the hell is Dr. Meggie Graham? You don't know that, but I'm telling you this right now.
Who am I?
Who is Dr. Meggie Graham?
Who am I?
Okay, so we met rewind, in June?
No, we met last spring. We started working together in June.
Yeah, that's right.
Yeah.
This year.
This year.
I feel
Less than a year ago, 6 months ago.
I literally feel like I've known you
Not
forever.
even 6 months ago.
So you came on as a client, you called me, and we talked about your brand. And as I started learning about your brand, I was like, hold up. I have a child that struggles with this. And I had gone through so many things. And everybody that is listening to this or everybody that follows me knows that Willie, literally, was having trouble in school. Last year, actually, in pre-K 4, we held him back because he wasn't progressing. Or he wasn't, before we held him back, he wasn't progressing. And I thought I was going to get him a tutor at 4. My community understands that, I brought them through the journey with Willie, right? So last year, he was in pre-K 4. He wasn't progressing. He was coming home miserable. He was acting out. He was only eating freaking red beans and rice. It was this thing. Everyone was like, I think of Willie when I see red beans, all this stuff. And I truly was about to get him a tutor, right? And I was at my wit's end. I remember taking him in to the doctor and I was like, I want every single blood panel run. I want all these things. He was then diagnosed, all before I met you, diagnosed with sensory processing disorder. And we were about to do a psych eval on him because I was like, something is wrong with my child. And at one point somebody was like, well, he might just be autistic. And I was like, when you hear that, obviously I'm still going to love my child, but it just takes the breath out of you. Holy shit, how have we missed this? How did we get here? What is going on? And then literally I met you in June. And as we were doing your content and we're hearing this, I'm like, wait, could this be a Willie issue? And there's so many women and moms out there that are fighting for their children and they don't know what airway is. They don't know if this is the issue. They don't know all these things. And I was like, I remember getting pushback from people in Louisiana because they're new as we've gone through the brand shoot this week, and we're talking about airway. And it's new and people think it's a fad or think it's fake or whatever. And I remember telling my husband and telling myself, honestly, and I think I've told you, if we do this and it doesn't work, well, guess what? We're checking something off the box so then I can find out what's happening to my child. And what I will tell everybody that's listening to this is every time you have a gut feeling and in mom intuition, trust it until the end. Don't just accept diagnosis. And the one thing that really happened in the content that we produced for you, the story that we heard, is you had a 7-year-old that was diagnosed with ADHD and he really wasn't, and he just had an airway issue. So I know I just gave y'all all a big overload before Meggie even talked, but this woman, I think, truly was a godsend in my life because now Willie is playing sports. He's eating other foods. He's a 5-year-old. So he's like, I don't want to eat that. That's gross. And then he tastes, he's like, oh my gosh, it's yummy. It's not because he can't breathe or he doesn't like it anymore. It's now he's just being a 5-year-old. So welcome to the podcast.
Hey.
Can you tell people first and foremost, what do you do? And how it was, even just having me, how did it feel having a mom say no, I'm going to fight for my kid, even when we could have had a little bit of pushback locally?
Well, thank you for having me. I'm Meggie Graham. I am a general dentist by training and now an airway fanatic. I've recognized the importance of nasal breathing. I didn't even know that we're supposed to be obligate nasal breathers as humans. And the influence dysfunctional breathing has on dentistry and our systemic health. So that's kind of my background and that's my passion. And my passion is fueled by stories like yours. And as unique as you are, all your listeners know that you are super unique. Your story, unfortunately, is not. It's mama bears like you. There's no one stronger or more fierce than a mama bear that's advocating for a child and following her intuition and following her gut. And I spent when I went down this rabbit hole and I started learning about this, I came back and like you connect these dots, these connections, and they seem so obvious and so simple, but it's not the way we're trained. We're all trained as physicians and dentists to work within our silo or our compartment. You know, ear, nose, and throat doctors are nose and throat. Pulmonologists do lungs. Cardiologists does a heart. Dentists do teeth. You know, everyone is very specialized in their part of the body, and yet the body is all connected.
Right.
We're not taught that way. And I know that's an oversimplification of the study of medicine, but that's really how we work. We work in silos and we bounce around with referrals. And when I started understanding and learning this connection to breathing and dentistry, and then breathing to systemic health, my first thought was, oh my God, we need to tell people. Like, people need to know this. It's so obnoxiously simplistic. And I spent several years pounding down the doors of physicians and pediatricians and other dentists, spreading the good word and trying to help them see the light like I had seen it. And gosh, it was frustrating, you know, and I spent quite a bit of time with a chip on my shoulder, angry that they weren't jumping on board with me. And I realized that that's not how we're trained, and no one's trying to do harm. But if you don't know something, you can't diagnose something. And if you can't diagnose something, you can't treat something. So now I really spend a lot of my time teaching moms, teaching patients, but really moms, because if I can teach them what to look for and teach them how to advocate for treatment for their kids, I'm going to have a bigger impact.
Yeah.
So for Willie, I remember you telling me we're at Mother's Day brunch and he just had a total freak out. And my first thought was, has anyone asked how he sleeps? And I asked you questions like, how does he sleep? Does he snore? Does he mouth breathe? And I remember you saying that he was a pretty restless sleeper.
Yeah.
They had a hard time getting up in the morning. And so we're not trying to create a problem that doesn't exist. We're not trying to create this thing that needs fixing. But when you start to check enough boxes and the sleep is poor and the eating is picky and the attention is lacking and the performance in school is a struggle, and then you start to look at that structurally, and the mouth is small and the teeth are crowded and the roof of the mouth is vaulted and there's not enough space for the tongue, and perhaps the patient's mouth breathing or snoring or clenching or grinding, you're checking a lot of boxes. And at that point, the most responsible thing to do is rule out breathing as one of the contributing factors. And look, people are so complex. We're so multifactorial. But like you said to your husband, if we fix his foundation, and Willie, if you don't mind me talking about him structurally, had a teeny tiny mouth, a teeny tiny mid-face, had dental crowding even in the primary dentition when he had his baby teeth. And that is not teeth that are necessarily overlapped, but teeth that don't have gaps. Because if you think about the permanent teeth being 30% bigger than the baby teeth, where are they going to go? Mm-hmm. So when he checks all these boxes and I look at him and he's structurally deficient, the worst case scenario, by making his mouth bigger, so we prescribed maxillary expansion for him, is that we make his mouth bigger and we give him more space for his permanent teeth, and he still has symptoms. Okay, great. It's not breathing. And many, many times when we fix the breathing, the sleep gets better and a lot of the other symptoms fall away. It's not magic. It's just simple science. And so I think that's the big piece of it. It's not new. It's not a fad. It's just connecting dots that have never been connected before.
Yeah. And truly, like, if you're listening to this, like, Willie did check all the boxes. Like, truly, he wouldn't play sports because honestly,
tired.
Honestly, I just thought that he just didn't like him. But I'm like, dude is an athlete. Now that he plays freaking soccer, I'm like, he can just walk up to a baseball and hit it. And I'm like, holy cannoli, you just couldn't breathe. He literally would run and he would shake his head and he would hold his head upward as he would run. And then he would wake up in the middle of the night. He would have accidents. He was a picky eater. He literally, I would be laying by him and his eyes are open and it looks like he's awake, but he's not awake. And then like I had to shake it. Like, it's like all of these things. I'm like, holy
think about how you feel. Like if you're tired after a bad night of sleep or several nights of bad sleep and you're fatigued, like you don't want to be an athlete. You don't want to work out. Like you're tired. Like this little kid is tired, but doesn't have the worldview or the vocabulary to say, I'm tired.
Yeah.
I don't feel good.
4.5 years, obviously, is why I'm like, of course he's a butthead. He had 4.5 years of like uninterrupted sleep. Like, I mean, not interrupted sleep. And it's just a lot for him. And I've seen just so many changes. And me just posting about this online, moms are so intrigued. And guys, literally, she looked at a picture. You even just like looked at a picture of Willie and was like, this, and this.
Right.
Can you talk to moms that are concerned? What are some things to look for?
Yeah.
And what's next steps? Like if they think that this is something, that it is something, and maybe they don't have this in their area, obviously everybody reach out to Meggie, obviously, but like give them some guidance on what's next.
So the first thing we ask is like, we have you know, in our practices, we have you fill out paperwork or health history. We're looking for historical pieces in somebody's medical history that could be symptoms of dysfunctional breathing. So things that we would ask are history of chronic respiratory illnesses, lots of ear infections, difficulty breastfeeding without a nipple shield, or they had to go straight to a bottle because they couldn't figure out how to nurse, or the mom had low supply. I mean, each of these topics could be a podcast on their own, but these are all things that could very much be related. Sleeping with their mouth open, snoring, restless sleep, nocturnal enuresis or bedwetting past the age of potty training. All of these things are extremely common, and so it's really easy to dismiss them as pathology. But just because they're common doesn't mean they're normal, and that doesn't mean that they're healthy.
Yeah.
And we live in an epidemic of undersized jaws based on so many factors, not only genetics, but the processed foods that we eat and the air that we breathe and all the allergens, that we're more susceptible to inflammatory diseases, that we're mouth breathing. And when we mouth breathe, it literally changes the shape of our face. So other things you could look for beyond the health history questions are there dark pools or venous pooling, dark circles under their eyes? Is the mouth open? Are the teeth crowded? Or if they're still with their primary dentition or baby teeth, are there spaces between their teeth? Because if there's not, that's dental crowding. Do they have a tongue tie? When you ask the child to lift their tongue, and this is a little bit more nuanced and harder, but sometimes it's very obvious and easy to spot. Is there a string under the tongue that is limiting not how far they can stick their tongue out, but how far they can elevate their tongue up? When you look at the back of the throat, can you see big tonsils? When they're sitting or standing, do they have their head forward, extended like Willie was doing when he was running? That's literally a compensation to try to create space for breathing. Like sitting where you are sitting right now, if you bring your neck over your shoulders and take a few breaths through your nose, if you have a constricted airway, you'll probably feel diminished airflow through your airway. If you don't, your airway might be fine, but if you're bringing your head directly over your shoulders and you have a harder time breathing, you're probably living in a compensatory forward head posture just to make it easier to breathe.
I'm literally, as you're talking, I'm doing it.
And so not one of these things can be diagnostic, right? So you ask like, what do we do next? Well, look for an airway-focused dentist or somebody that understands the importance of nasal breathing. That might be a dentist, that might be an ear, nose, and throat doctor, but I assure you it's not all of us. In fact, we're the minority. And I'm happy to be a coach and help. I can't diagnose over state lines, yet I can help you identify things to look for in your own child and give you suggestions for how to find a team or what questions to ask. Because like I mentioned before, you're so unique, but your story is what we hear 10 times a day.
Yeah.
And usually by the time you come to see us, you've sought out other opinions, and we're third, fourth, sixth, seventh, eighth consult. That's a lot of time, money, energy trying to find an answer. So if I can help condense time for people and know what to look for in a provider and know what to ask, I'm all about that.
Yeah. And I think too, as a mom, and it's scary because I remember whenever we were like, okay, because I did think this. I was like, is this just a fad? Is this something I'm going to do to my child? Is it going to hurt him? He's so young. Am I being crazy?
Yeah.
Because as a mom and you keep going and they're saying nothing's wrong with your child, or you maybe got a diagnosis and it worked for a second, but then now it's not working. And I'm like, what's going on? And so I will tell you, like, obviously before we put the palate expander in his mouth, I was like, holy shit, we're going to cement something to his mouth. And this is going to hurt him because I feel like I would be so uncomfortable with this. But you were right. You're like, kids are resilient. And like, he laid in that chair and he was so good. And just the behavioral differences we saw within the first week, the first 2 weeks, I was like, holy crap. How did it take me so long to know this and to hear about this? Which is so sad because there are so many moms. Just freaking posting a picture of you yesterday. Like 5 people were like, I need to know who this is. And in just like that alone, I mean, yes, to the world saying that out loud, that might sound like a low number, but at the same time, these are parents that have older children like I do, meaning 5, 6, 7, 8, that have been told, oh, there's nothing wrong, or we sound crazy or whatever. But when you have like a mama intuition, like fight for your child. And like, that's what I solely believe. Now we are talking a lot about children, but being with you over the last 2 days, I'm like, holy shit, I think I have like obstructive airway because I have dark circles. You've asked me, you've talked about how Hashimoto's could be stemmed from, right?
So yeah, so with adults, one of the things we hear from pediatricians, I'm going to answer your question, I promise.
Yeah.
But I want to give a little bit more background, is one of the things that we hear from pediatricians often, because they're the ones that see the kids the most frequently, is don't worry about it, they'll grow out of it.
Yes.
And when it's a breathing issue or it's a structural issue, there's science that shows, and I can cite all the science, I can put it out in your podcast notes later, but there's research that shows that kids don't grow out of dental crowding past the age of 4. If we don't change dysfunction muscularly before the age of 4, they're not going to self-correct. And so we need to do some sort of intervention. And kids are resilient. They're unbelievably resilient and able to tolerate the things that we can do non-invasively, like what we did with Willie, or what you guys did with Willie, which was maxillary expansion. As we age out of childhood and we age into later childhood, teenage years, and adulthood, the symptoms change, the compensations change. So it might seem like something went away. You might stop bedwetting, but you might still have a hard time breathing. And so while that symptom may have gone away, the dysfunctional root cause is still present and it just presents in another way. So for adults on our health history, they might have historical things that are similar to what a child would show up on their health history, chronic ear infections, difficulty nursing, all of those same things. But an adult, they might have cardiovascular disease. They might have anxiety and depression. They might have headaches. They might have clenching and grinding or tooth attrition or cavities. They might have hormonal issues. And the connecting the dots here is if we can't breathe well, we can't sleep well. And if we can't sleep well, we can't get the ideal sleep architecture that is so pertinent to our overall well-being and health. Functionally, structurally, hormonally, emotionally, so much happens while we're sleeping. Not only in a quantity amount of sleep, but in a quality amount of sleep. So if you struggle with some of these things, again, if you're checking enough boxes, the most responsible thing you can do is rule out that breathing is part of the story. Now, we live in a society that we put out medical fires. And so what that means is, let's say you're like, okay, I'm listening to this podcast. I'm going to go talk to my primary care physician. I'm going to convince them to give me a sleep study. Well, if you're the majority of the patients that we see, you probably don't have obstructive sleep apnea, or maybe it's mild sleep apnea. But if it's not moderate or severe sleep apnea, you're not even going to be offered a solution, which is a CPAP or a mandibular advancement device. Basically, if you have moderate to severe sleep apnea and you're offered a CPAP or some sort of treatment modality, you are sick enough to die in your sleep. And they're like, here, take this device so you don't die in your sleep. If you have mild sleep apnea or upper airway resistance syndrome, or you snore and you're told don't worry about it, basically they're saying you're not sick enough for help. But they're not connecting the dots. And you're sitting here putting out all these other fires, clenching, grinding, dental issues, hormonal issues, et cetera, et cetera. So at this point, if you're checking all these boxes to figure out if you actually have an issue, getting a sleep screening to look at your sleep architecture to see, is your REM interrupted? Do you have a lot of activity, restless leg? Do you have a lot of interruptions? Do you feel really fatigued despite sleeping for 8 hours? These are enough signs that your sleep is disrupted from dysfunctional breathing.
I'm like, I feel like you just spoke to my entire soul. What about, okay, we're going to cut this out if you say no, Shelby, you're crazy. What about mitral valve prolapse?
So I'm not a cardiologist or a cardiac expert by any means, but we do know that cardiac disease is very much related to poor sleep. And we know that poor sleep is related to poor breathing. So actually, one of my friends who is a cardiologist told me that one of the first things that will be recommended if somebody comes into the emergency department with a heart attack is, let's get them in for a sleep study. So it's very reactive. Now for mitral valve prolapse, I don't know enough about it to be able to speak to it, but I know that there is a connection to cardiology disease,
Cardiovascular disease.
heart disease.
Don't tell me that. I'm already anxious. I was diagnosed with that at 18.
Okay, so I really want to lean into this because you've brought this up several times. When we give this information and when we connect the dots, when I was the student connecting these dots and I recognize this in myself because I'm the airway patient. I have all of these things. It causes anxiety because to know of a problem and not have a solution is extremely scary. But the thing to keep coming back to is this is happening whether or not you know it or not. All this is doing is giving you the opportunity to uncover different paths forward. So if you had never met me and you didn't start to wonder about this for yourself, or you didn't change Willie's path, you all would have had a story. You all would have had a life. You all would have had a lot of joy and a fabulous life. But now you get to have the option to have a different trajectory with less suffering, less intervention, less health issues. So I would encourage people that are feeling overwhelmed as you're checking your own boxes to see it as a superpower, that all this is an opportunity to shift gears and ask more questions.
So what is your plan if an adult, is it just like what if you would do for a kid? Like, cause y'all keep saying like your structure is formed at a certain age. So when an adult comes to you, what is the protocol here?
We always start with nasal breathing. So the very first thing, when we talked about this with your team that's been amazing with us the last couple of days is, and you can do this at home while you're listening to us, take a breath through your nose. Now, very gently pull laterally on the side of your nose as if your fingers were a breathe right strip and take a couple more breaths. Is that easier to breathe through your nose? Is there less resistance? For some of you, there's going to be no change. For a lot of you, you're going to feel less resistance to airflow. If you feel less resistance to airflow when you naturally support like that, invest in some nasal dilators. Your maximum out of pocket for that is going to be about $40.
And we're going to put your link at the link below.
Yeah, we'll put the link to intake below. There's breathe right strips, there's intake, which is magnetic. Those are my personal favorite. I tend to find them to be the most comfortable.
Do you wear those when you sleep at night?
Yep.
Okay.
I'll wear them during the day. I'll wear them when I go walking.
I don't know if that's what random sidebar. Alex Hormozy always speaks with a strip on his nose. And I wonder if that's what, anyway, keep going.
Yeah. I mean, those are just, and you'll see professional athletes wearing them. They're designed to help airflow. If you can tolerate that and that helps, the next thing to do would be to try lip taping. Don't put tape on your mouth and go to bed for the very first time. Sit, watch a show, read a book, do it in conjunction with nasal support. How does that feel? If it feels good, try sleeping with it. If it keeps you breathing through your nose at night, that might be enough to change your sleep quality. That's not invasive. That's not major intervention. And it can be a control while you figure out the next pieces. If it is truly something structural, perhaps there's an ear, nose, and throat procedure. Perhaps we can do maxillary expansion on you. We can use bone-borne expanders to actually expand the maxilla in an adult. I went through that as a patient, and I do that for patients all the time. There are surgical options to make put the jawbones in other positions. There's a lot of different things that we can do that have different degrees of invasiveness and help. But the first thing you need to understand is what is the diagnosis. And that's where the problem is with traditional medicine of handing out CPAPs and mandibular advancement devices. When I say a mandibular advancement device, it's a device that you wear on your teeth that holds your mandible or your lower jaw forward. It advances your mandible. And those can be super impactful if your lower jaw is deficient and set back while you're sleeping to hold it forward. It can create more space for your airway. If your upper jaw is the culprit or the problem, you can advance your mandible as far as you want and you're never going to feel any better because you can't physically move the maxilla or the upper jawbone arbitrarily or temporarily.
My mind's blown. I feel like there's just so much goodness to this podcast. And just explaining to people that I heard it I think it was last year. I don't remember exactly where it came from, but I heard a podcast and it was a neurologist. I'm going to butcher this. It was a doctor and a lobbyist. It was Tucker Carlson's show. I know what. He interviewed a neurologist and a lobbyist, and they talked about big pharma and how, just what you said, they teach doctors specifically your face or your heart or your lungs or whatever, and they never allow you to really connect the body. They're just fixing that one problem. And so as people are listening to this, guys, ask questions, like reach out to you as a human being. Or if you have more questions and you don't think that your child, if you're not accepting that your child is ADHD or is sensory processing disorder or have mitral valve prolapse one day when you wake up at 18 years old or was overcrowded when I got braces, like all these things that you've been telling us for the last 2 days, I'm just now connecting the dots. I'm like, holy shit, I need to do a sleep study now.
Well, and here's the thing too, is like, it could be both, right? You could have sleep-related breathing disorder and ADHD. But if we can fix the breathing and fix the sleep cycles, we're going to help control the symptoms related to that. And you're automatically going to be healthier and feel better.
Yeah.
Even if you're suffering from something that's unrelated to breathing.
So, okay, wait, let's go here. So Hashimoto's, you've told me a couple of times that you're like, okay, Hashimoto's could be an airway thing. Or I don't want to quote what you said because I don't remember exactly what you said. But there are so many women that when I came out being diagnosed with Hashimoto's that started asking me questions. Is this something that could be in relation to possibly have an airway, or like what? I guess explain to me why that is something that could be in relation to that.
I'm glad you're touching on this because I want to clear it a little bit up because I didn't say exactly that. But what I think you're referencing is if you can't breathe well and you can't sleep well, your sleep cycles are going to be off. And one of the most important things that happens while we sleep is hormone regulation. And that's the relation to bedwetting. We don't produce antidiuretic hormone. And so the bladder continues to produce urine. That's a really simple example.
Yeah.
But thyroid hormone is a hormone. There's so many different hormones that are regulated while we sleep. And so if you have a thyroid issue or a hormone imbalance, one of the things that should be checked is how are your sleep cycles. Now, could you have Hashimoto's and hormonal issues that are unrelated to breathing and sleep? Absolutely.
Right.
And I'm not an endocrinologist and I'm not an expert on this, but I do know the importance of sleep. So I always suggest if you're struggling with systemic issues, hormonal issues, and you check enough boxes, it makes sense to find out, is part of your story, is part of your systemic health makeup a breathing issue?
Yeah.
Could it help you with other issues or have symptoms fall off your list? Absolutely. Is it a guarantee? Absolutely not.
Right.
Right. So that's the connection.
Yeah. So if you're listening to this is not her diagnosing anyone. I think ultimately you just know so much about my life at this point and like my kids that like just the genuine conversations we have. I think the overall point is don't accept things if you don't feel like they're accurate. Like in your gut, if you feel like something is wrong, just ask questions and do your research.
Absolutely. And we live in a time when biohacking is so popular and people are seeking longevity and health because there's no better sign of wealth than health, that we have access to some really amazing tools without medical necessity or referral. So like we use a sleep screening device called Sleep Image that is non-diagnostic because it's not read by a sleep physician. However, it gives us objective data on how the sleep cycles are and what's happening from a breathing perspective and a cardiology perspective. You can do that with an Oura Ring or a Whoop or your Apple Watch. Like you can start to track your sleep cycles. Now, as technology improves, they become more and more sensitive and you might have a false sense of security because the device that you're wearing might not be sensitive enough. But there's a lot of ways you can start to pay attention to these things. And you can even try things like the nasal dilators and mouth tape to see how you feel subjectively. You don't need a diagnosis to make those changes.
I know. Okay. I feel like I'm like getting my own counseling session here right now. Sorry guys, if you're listening to this, whatever, I don't care. Okay, let's go into Meggie. Okay, let's go into you're co-founder of Untethered Airway Health, and if people wanted to work with you, do you consult even if they're not in Wisconsin? Yeah,
so we have 2 Untethered Airway Health Centers currently. We have one in Denver, run by my business partner, Liz Turner, and we have one here in Wisconsin, in Brookfield. So it's pretty accessible to southeastern Wisconsin. And we are on a mission to teach other dentists. So right now we have a course out there and we're teaching, I think we've got about 60 students right now. So we're really trying to educate dentists so that we can offer better access to care.
Yeah.
People travel to see us all the time. They come out of state. They fly all over the place to see us. If you're able to come and see us for a consult, that's ideal. We love that because we get to see you. We get to take records on you. We get to actually look at you, and make a physical diagnosis. If you're not able to get to see us and you can't find somebody with this kind of background or knowledge, I am more than happy to sit down virtually and talk to you and offer coaching services to help you find somebody in your area or help you make decisions about what the next steps might be.
I know. I was so close to flying to you. Do you remember that? Mm-hmm. I was like, I'm just getting on an airplane.
I was like, let me talk to your team first. Let me see if I can help coach them through it.
See if we can find someone locally.
That's a really cool thing too, right? So like through that process, through this coaching service, you know, as I meet people, they'll put me in touch with their local teams. And sometimes I am speaking to deaf ears, and other times I'm met with intrigue and willingness to think outside the box. And that's really fun too. So not only, if you reach out to me, not only could you be potentially helping your child or yourself, it might even be a way to connect with more providers and help spread the word that way.
Yeah. And now you're about to branch out a little bit on your personal brand journey. Can you kind of go into that? So guys, she was a restorative dentist. Did I say that right?
Yeah. General restorative dentist, a family dentist, cosmetic dentist. You know, I did a lot of comprehensive dentistry. I would do fillings and crowns and veneers and kind of see patients through a lifespan, right? Children through adults. And was my first chapter. And then Liz and I started Untethered, and that is a specialty clinic. So anyone that comes to Untethered has a dental home, and they're seeking airway guidance and airway solutions at Untethered. And now I am branching out further to do more coaching dentists, coaching parents, how to implement this kind of treatment into your treatment planning and your repertoire as a provider, and helping you as a parent find the care that you need.
Yeah. So you don't practice anymore?
No, I haven't. Yeah.
Can you tell us like the journey of like what happened?
Yeah. So I finally had to stop working. I worked through a lot of chronic pain for years and a lot of things that could have been my rock bottom as far as, the pressures of dentistry. But I ultimately was forced to stop practicing due to a neck injury that caused neuropathy in my thumb, index, and middle finger on my right hand, which is my dominant hand, is the hand I work with. And that neuropathy causes like a pins and needle or sleeping foot sensation all the time. But it also was causing me to lose sensation enough that I started to drop instruments. And so I was crossing a line and becoming at risk for harming patients. So that was where I decided that I had to put my handpiece down.
And now I know. And last night as we were walking through the airport, I had asked you, I was like, you worked so hard to get here, which today I actually learned way more about you because you wanted to go to medical school and then you switched to dentistry. And then like we went through this whole journey. You're going to have to follow her to hear that because we only don't have like, I can talk to you forever. But anyway, we were walking through the airport last night and I was like, did you feel like it was such a punch to the gut because you lost your identity?
Totally. It really did. And I think that, you know, in hindsight, looking back, if I could get a do-over, that's my favorite phrase these days, I would have done things differently and I would have put focus on identifying who I was outside of my profession. But I was so all in on being the best dentist I could be that I committed all my resources and energy to continuing education and traveling and learning, that I really lost sight of who I was outside of my profession. So when I had to physically stop working, I had a pretty big breakdown of who am I? Who am I outside of this? And I realize now I'm putting the pieces back together and I'm realizing now that I am more than my profession, but I'm still trying to figure out exactly who I am.
But now your mission is so beautiful. And like we interviewed you a while ago and it's really sad to say because women actually tie themselves for their identity to what they do in life, to their profession, what do they provide for the world, instead of thinking like, who am I actually as a human being? Like, who was I before all of this? And just, we lose ourselves along the way. We lose ourselves when we have children. We lose ourselves when we get married. We lose ourselves when we go into a profession field because we're trying to be so much. But what is one, and that's not bad. That's not me saying it in a negative way of like, we lose ourselves when we have kids, like not that at all. What is one piece of advice you would give people because you are on this journey now and you've lived through the losing yourself. Now we're back on the journey of finding ourselves again. What is one piece of advice that you would tell women in any industry of how to keep, their identity secured for them, not just their profession?
Do whatever work you need to do. And this is really vague. And, this could be a really long conversation about the specific steps on this, but like figure out who you are from a perspective of what are your values, what's important to you, what are your goals and boundaries, and have that be what leads all of your decisions. And everything outside of that is extra. So like what I mean by that is, you know, being a mom fills my cup. Like that's a huge part of my identity. It's not the only piece of me, but it is going to fulfill the piece of my identity that is love and caretaking, and being a wife is in that same category. And then if you can lead with that kind of clarity and really understanding what your true wants are before letting in all the noise, before letting in all the shoulds, before letting in all of the responsibilities that we're constantly bombarded with, and let that be rock solid, the rest of it can be adjunctive and like add to your fulfillment rather than just sucking you dry.
Yeah.
And I know that's the reason why I kind of prefaced it with like, that's going to sound great, but like if you're living in the middle of drowning, or if you're living in the middle of feeling like you're at burnout, that's going to feel like, thanks, Meggie. That was helpful.
Yeah.
And I think that for me, one of the most powerful things that helped shift my mindset on that was hiring a personal coach. And I spent decades and years aren't decades. I spent decades in, therapy and counseling. And while I think talk therapy is hugely beneficial, it takes a lot of time. And at a certain point, especially when I was at my most spread thin self, I just wanted somebody to help me condense time. And so I think that that's really what I found with life coaching was, yes, it's important to understand how your brain works. Yes, it's important to understand where you came from and why you are the way you are. And what's the roadmap? What's the game plan? Let's implement. And for a doer like me, that was really giving me permission and having somebody hold me accountable to getting things done and acting and leading by action. So I guess in a really long-winded way to answer is find somebody that can hold you accountable to holding you to what is important to you.
I love that. And now your mission is freaking amazing, even though as we walked through the airport and you said, I feel like I lost who I was or my identity. Now you're on this mission to help women dentists really avoid that burnout, or if they're in that burnout, that you're here to help them, or if they're on that hamster wheel, like you're the advocate for them because you've done it, been there, done that. What do you have to say towards that if there are dentists that are listening to this podcast?
The physical end to my restorative career was so sad and such a catastrophe for me. But it gave me the ability to look backwards at a profession in hindsight way sooner than I should have been able to, not in retirement, but in the prime of my career. And I recognize in hindsight with space that our profession has the potential of being so cool. Right? Like it's artistic, it's scientific. We get to work with people. We can do it in so many different ways. We can own a business. We can work for somebody else. We can be autonomous. And if we don't recognize that and carve out space to protect ourselves, we're never going to live that beauty, and we're going to just survive it.
Yeah. I can't wait to watch you flourish. I'm so excited. When you meet someone, we've said this multiple times, like in person for the first time, and you feel like you've known them. And I do truly thank God every day that you came into my life because you fixed my child. Like, do I think that he's just crazy and silly? Yes. But also at this point, this is his age, but like the transformation we've seen in such a short period of time, for not backing down in what I knew in my heart and my gut. And after hearing people tell me I was crazy and like you're putting your kid through the ringer, and now looking at him, he's playing sports, he's eating, he's lovey, he sleeps through the night, there's no accidents, like all of these things. The teachers love him. They're like, he's the sweetest thing. It's the simplest thing. He gets out of the car in the morning and walks in. He used to last year scream and wrap his hands around my neck. I was not allowed to walk him in because it was so hard to get him off of me. It was all these things. And now he's like, bye mom, I'm going to school. And yes, they do get older, and so they do get more mature, and they do whatever anybody's gonna say, but also there was something wrong. And so like you identified that, and I just like forever am grateful for you forever. And I just love that people come into your life at a certain point, and I think that it was like the perfect timing. So thank you.
I think timing is so important. And I think that what you just said is another piece of advice that I'd give not only dentists, female dentists or moms, but like anybody, is just follow. If you can create enough space to hear yourself, give yourself enough space to listen to that gut instinct, whether it's towards burnout or towards the health of your child or the health of yourself, like follow that. Like that's really powerful. And, I mean, thank you for your trust. I don't take that lightly. That's such a gift. And to follow my recommendations for your son is wild to me still. Not because I don't believe in the science or believe in it, but just like the fact that, people give me their trust is just such a gift. I don't take it lightly.
And honestly, like, especially with so much pushback that there is in the world of airway and like me just saying no because I trusted you and I didn't even know you. Like it was literally like 1 month into our even relationship of knowing one another that I was like, no, we're doing this. And so I appreciate it. So those of you listening, this was a very short episode for a very long, like it could have been forever because you're just such a freaking.
We can do part B.
Part B. They can go follow you. All the crap we just got of you the last 2 days.
Yeah, follow along for some amazing content.
We're going to put all the things in the show notes, but thank you so much for being here today. I just freaking adore you.
I adore you too. I love you.
Oh my God.
Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
please share it with someone who would benefit from hearing this. And don't forget to subscribe.
Want to learn more about airway health or connect with our team?
Please visit our website, untetheredairwayhealthcenter.com, or follow us on Instagram @untetheredairway.
Until next time, bye.